Have you ever wondered what happens to divers when they resurface too quickly? What are the dangers of resurfacing too fast? The answer involves a condition that can leave a person paralyzed within minutes, or in severe cases even cause death. It's called the bends, or decompression sickness. To understand the bends, we first need to grasp something we completely take for granted: the immense force of the air around us. Right now, as you watch this video, you are being pressed on from every direction by the weight of the Earth's entire atmosphere. There is roughly 1 kilogram of weight sitting on every single square centimeter of your skin. On your shoulders alone, that's several tons of force pushing down. We don't feel this crushing weight because the pressure inside our bodies, in our lungs, our blood, our tissues, perfectly balances the pressure outside. 1 atmosphere of pressure is immense, and here's where diving becomes dangerous. For every 10 meters you descend underwater, you add another full atmosphere of pressure. At 40 meters deep, a diver experiences 5 atmospheres, 5 times that already enormous force pressing in from all directions. When divers breathe underwater, they're breathing regular air, 79% nitrogen and 21% oxygen. But this air is delivered at the same pressure as the surrounding water. At 40 meters depth, that's 5 times normal pressure. Here's what happens. Nitrogen dissolves directly into the diver's blood and tissues. At the surface, nitrogen is harmless. Your body doesn't use it, you just breathe it in and out. But underwater at high pressure, nitrogen dissolves into your bloodstream following a principle called Henry's law. The higher the pressure, the more gas dissolves into liquid. Think of a carbonated drink. Carbon dioxide is dissolved into soda under pressure at the factory. The moment you crack open the bottle and release that pressure, the CO2 can't stay dissolved. It escapes as bubbles. A diver's body works the same way. During a 30-minute dive at 40 meters, nitrogen saturates their blood and tissues. As long as the pressure stays high, the nitrogen remains dissolved. Everything is fine. The problem starts when that diver begins to ascend and pressure drops. When a diver ascends, water pressure decreases. At 20 meters, it's 3 atmospheres instead of 5. At 10 meters, just 2 atmospheres. The nitrogen dissolved throughout the diver's body suddenly finds itself in an environment where it can no longer stay dissolved. Just like opening that soda bottle, nitrogen comes out of solution and forms bubbles inside the diver's bloodstream and tissues. These nitrogen bubbles are dangerous. They block blood vessels, preventing blood flow to organs and tissues. They accumulate in joints, shoulders, elbows, knees, causing severe joint pain. This is where the name the bends comes from. Divers would bend over in pain from bubbles in their joints. But it gets worse. Bubbles can form in the spinal cord, causing paralysis and loss of sensation below the affected area. Bubbles in the brain cause confusion, dizziness, and loss of consciousness. Bubbles in the lungs prevent oxygen from entering the bloodstream, causing respiratory distress. The faster a diver ascends, the more dangerous it becomes. A safe ascent rate is about 10 meters per minute, giving the body time to process the dissolved nitrogen. But if a diver shoots to the surface at 60 meters per minute, pressure drops 6 times faster than the body can handle. Nitrogen bubbles form explosively throughout the bloodstream and tissues. The results can be catastrophic. Professional divers use several techniques to prevent decompression sickness. First, slow, controlled ascent. Divers ascend at roughly 10 meters per minute, slower than a casual walk. This gives nitrogen time to diffuse from tissues into the bloodstream, where it's exhaled through the lungs naturally. Second, decompression stops. During ascent, divers pause at specific depths. A diver returning from 40 meters might stop at 9 meters for several minutes, then at 6 meters, then at 3 meters. During these stops, they continue breathing normally while nitrogen continues escaping from their tissues. These stops can add 20 or 30 minutes to the total dive time, but they dramatically reduce the risk of the bends. Third, dive computers. Modern divers wear dive computers on their wrists.
These devices continuously track depth and time, calculating exactly how much nitrogen has dissolved into the diver's tissues. The computer then determines which decompression stops are required and for how long. It's real-time nitrogen tracking that saves lives. Fourth, dive tables. Before computers, divers relied on pre-calculated charts called dive tables. These tables show safe dive times at various depths and indicate required decompression stops. Divers still learn these tables as backup and for understanding diving physics. Despite all precautions, some divers still develop the bends. When this happens, time becomes critical. The first treatment is immediate oxygen. Giving the diver pure oxygen at the surface creates a chemical gradient. Nitrogen in the bubbles diffuses into the oxygen-rich blood, helping shrink the bubbles. But the definitive treatment is the decompression chamber, also called a hyperbaric chamber. This is a pressurized metal vessel large enough for a person to lie inside. Here's how it works. The patient enters the chamber, and medical personnel increase the internal pressure, often simulating being at 18 meters underwater. This increased pressure compresses the nitrogen bubbles back into dissolved form, immediately restoring blood flow. Symptoms often improve within minutes. While at this elevated pressure, the patient breathes pure oxygen. Remember, pure oxygen at depth is normally dangerous, but in the controlled environment of a medical chamber, it's safe and therapeutic. Oxygen accelerates nitrogen elimination. Nitrogen diffuses from tissues into the oxygen-rich blood faster than normal. After sufficient time, medical staff slowly reduce the chamber pressure over several hours, similar to a carefully controlled dive ascent. This gradual decompression allows nitrogen to safely leave the body without reforming bubbles. Severe cases may require multiple chamber sessions over several days. Success depends heavily on how quickly treatment begins. Divers treated within hours of symptoms generally recover well, while delays can result in permanent damage. The bends demonstrates how the human body responds to extreme environmental pressure. By understanding how gases dissolve under pressure and how they behave when pressure decreases, divers can follow procedures that make deep diving remarkably safe. Controlled ascent rates, decompression stops, dive computers, and access to decompression chambers have transformed diving from an extremely dangerous activity into something that millions of people do recreationally every year. But the ocean doesn't forgive those who ignore these rules. The physics of pressure is unforgiving, and the bends remains a serious risk for anyone who surfaces too quickly.